Hi there, my name is Max, and I'm a third-year medical student at the University of Michigan Medical School, representing a group called Medical Students for Disability Health and Advocacy on our project called Integrating a Standardized Patient with a Disability into University of Michigan Medical School Curriculum. Starting off, I'd like to briefly discuss some background. So medical students engage in standardized patient exercises fairly regularly, and these are designed to teach students the fundamental history and physical exam skills. And these are frequently, and in my experience, almost entirely performed on individuals without a visible disability. And this is in stark contrast to the 18% of individuals within the US that identify as having a disability, and the likely larger proportion that are actually seen regularly in the healthcare setting. Now, in the past, UMMS, or University of Michigan Medical School, has done great work to improve its disability curriculum. However, we would argue that there is still a large gap between preclinical SP, or standardized patient preparation, and actual clinical experience. And this project aims to begin to fill that gap in education. So I'll get to our end goal on the last slide, but for this project, we're aiming for a shorter term goal that we think could be accomplished within the next academic year. And I've outlined it here. So we are currently, and these are ongoing, so we're currently collaborating with other medical schools that, in our opinion, seem to include a more comprehensive disability-related education or curriculum. And then our aim for this year is to hold an optional disability-sensitive history and physical exam session prior to students entering clinical rotations. And at UMMS, this time period is called Transition to Clerkships. And then, of course, we plan to collect data on the experience. Some of that data that we aim to collect are both pre- and post-session surveys using a scale called the Disability Attitudes in Healthcare scale. And this is a standardized and validated scale that's been used in papers. So if we collect data before and after the session, we hope that attitudes towards disability will change, and we can show that the session did have an impact on students' attitudes. But then we also think that it's important to collect longer term data. And we're going to do this by following up with students during their family medicine rotation of M2 year, and we'll collect data using the same scale. Now, an important difference here is that we're going to survey all medical students as they go through their family medicine rotation. So that way, the students that actually participated in the session could be considered the control arm, and then, the experimental arm of the students who actually participate. And then the students that didn't participate could be the control arm. So that way we can hopefully compare between the two and see if there was a difference between those that participated and those that didn't, although we hope that everyone would participate in the session. And then we'll aim to use that data in order to move forward towards our longer term goal. And that future long-term goal is to fully integrate standardized patients with disabilities into any standardized patient session at UMMS. And this could look like a student learning the cardiac exam on a patient who uses a wheelchair, or a student learning the neurological exam on a patient with a neurological disability like cerebral palsy. And we think that this will accomplish multiple goals, including it'll better represent the patients that we actually see in the hospital. It'll allow for ample educational opportunities for students, and that overall, it should promote a smoother transition into clinical encounters for medical students. Thank you very much, and I've included my sources here.